Clostridium difficile. Okay, this is an endospore forming soil bacteria, which is also interesting because for some people it's just part of their normal biota, their normal flora of their intestinal tract. For patients that are going to be having a Clostridium difficile infection, okay, it's become an opportunistic infection, you can see what is referred to as a pseudomembrane colitis, okay? It's usually associated with post or in the middle of antibiotic treatment. Turns out, as a response to the presence of the antibiotics, the Clostridium difficile will start clumping together and will start secreting peptidoglycans and sugars and will form a covering. They call it a pseudomembrane, as you see down there on the right. It's not a true membrane because it's not made of lipids, but it is a covering that will mask over the underlying Clostridium difficile colony. As the colony grows, that membrane will stretch and just be replenished and it will start increasing in size. We find that Clostridium difficile for the most part is kept in check when there is a healthy microbiota in the large intestine. The normal flora is there, it's healthy, the numbers are where they need to be, the diversity of the different species is where it needs to be. Clostridium difficile is kept in check until you start taking antibiotics for different infections and competition goes away. Clostridium difficile now has the ability to spread, now has the ability to take over. We find that Clostridium difficile makes two types of toxins, two enterotoxins, toxins A and B. Both do direct damage to the intestinal wall, to the intestinal epithelial lining of the wall. The damage will lead to necrosis, so you'll end up with spots of necrotic tissue dotting all along the large intestine. Patient presents with Clostridium difficile, you're going to see abdominal cramps, a high fever, and their white blood cells are going to start going up and they're going to start migrating and causing inflammation of the large intestine. Colon's going to get inflamed, okay? And as it's getting inflamed, those spots of necrosis are going to get bigger and bigger, and the healthy tissue between those spots will literally slough off, will peel off, and that's what they're going to pass out. If this infection is not treated quickly enough and aggressively enough, these areas of necrosis can not only spread diameter-wise, but spread by penetrating the layers of tissue that make up the large intestine, and you can end up with a perforation. Depending upon some antibiotics, clindamycin, ceftriaxone, fluoroquinolone, if a patient's taking those and suddenly starts complaining about, they're cramping up really bad, they're having a fever, they're starting diarrhea, this could be signs of C. diff, C. diff, Clostridium difficile, they refer to it as C. diff. C. diff developing in their intestines, and they need to be taken off that antibiotic, the antibiotic change, and some clinicians are now saying you need to somehow reintroduce the probiotics, get the bacteria, the good bacteria back there. Patients are showing mild cases of a C. diff infection. Metronidazole will handle. It won't wipe out all the competition. There'll still be some competition, and it'll bring the C. diff numbers back down to manageable levels. If it's going now to the severe point, vancomycin, which is our last great hope for many different bacterial infections that are resistant, that's going to be the drug of choice. Part of the problem with C. diff is the fact that whenever the bacterium is stressed, loss of nutrients, loss of water, presence of a damaging compound such as an antibiotic, Clostridium difficile will begin forming an endospore. So the antibiotic can remove the vegetative cells, but the endospores will still be there within the tissues of the large intestine. Once the antibiotic goes away, the endospores germinate, and you have C. diff infection all over again. So for patients that are showing severe cases of this, not only will the vancomycin dosage be higher, at the higher end of normal, but it'll also be carried out for a longer time period.